This is Roger Green, host of the Surfing the NASH Tsunami podcast. Today, we are offering 5 conversations from episode 27, our preview of key sessions and abstracts at next week's EASL Congress 2023, plus a 6th separate conversation with Arun Sanyal and David Kleiner on the benefits of AI-assisted histopathology in anticipation of a major prospective study on the topic. This is the final conversation with Jörn, Schattenberg, Ian Rowe, and me discussing presentations and posters of interest at EASL Congress 2023. It starts with Jörn mentioning a Friday afternoon session on NAFLD clinical aspects. He commends the session for, and I quote, being very close to what we're thinking when we treat patients today. Ian shares his interest in one paper in the session that shares work coming from the University of Edinburgh, and Jörn expresses enthusiasm for paper 87, which takes a more detailed look at fibrosis scoring than our historical one-dimensional 5-level system. In the rest of the conversation, we address 3 other topics. The session that Jörn is co-chairing on Friday, revisiting lean NASH. I mention a second session Friday afternoon, which focuses on various RNA-related issues. It's a little bit over my head, but I'm hoping that we will have somebody sharing information on that in one of our real-time presentations next weekend. Finally, Ian discusses the focus of a Meet the Experts session on early diagnosis he is leading on Saturday morning. Finally, Jörn shares his excitement about the 6 or so NAIL-NIT papers on non-invasive diagnostics that will appear throughout the meeting, some in presentation form and others as posters, including a poster he will present. With major drug development presentations led by the Meister NASH results, new material on diagnostics from Litmus, NAIL-NIT, and others, and the nomenclature presentation, the EASL Congress will be 3 very packed days. We will be reporting twice on Saturday, once before the Saturday session and once afterwards, and I may attempt to post some one-on-one interviews on Thursday and Friday. So, when listening to this episode, think about what you want to attend in person or virtually, and just sit back, listen, enjoy, learn. When you're done, join the dialogue in our LinkedIn discussion group. Next topic to move on to, gents?
Jörn Schattenberg.
I'm just following the abstract sessions. I'm not sure you wanted to highlight something specifically next, Ian, but there is a NAFLD clinical aspects on Friday afternoon, 5 till 6:30. It's chaired by Nicholas Goossens and Hannes Hagström. Very clinical presentations, five presentations. Real-life data, use of anti-diabetic and lipid-lowering medications in the US, risk stratification, MEFIB, MRI, PDFF. There's another digital pathology, stain-free imaging, the prediction, and here you go with the actually prediction of outcomes. It's presented by Timothy Kendall from Edinburgh. Then there's a SEMA paper in there and real-world data from the Target NASH. So I think this whole session is very close to what we're thinking today when we see patients. Can I treat him with semaglutide? What's his risk? Will he decompensate? How can I risk stratify? This is, which drug that I have available should I use to manage my patients? This is for somebody who sees NASH patients. I think this is all covered here.
I agree with that. I thought it was a really fascinating session.
Ian Rowe.
Yeah, I'm looking forward to seeing the Edinburgh Data. I've not seen it in development, but I've been talking to Tim Kendall and John Fallowfield about it intermittently over time as a sort of interested observer. And they've accumulated a lot of biopsy samples from across Scotland and have put them into a common data warehouse. And that's allowed them to do some research and to think about prediction of future events and to think about biology too. But it also is in a sort of common data commons so that they will, so that data is stuff that's available to other people to use, and I think seeing it out in the wild for the first time will be really good.
Yeah, if we stay with that abstract and it's oral presentation 087, the nice thing is that I think it tries or it aims to advance a segmentation of fibrosis beyond those 5-tier staging systems we're using, right? The 0 to 4, and there's actually, they mention 184 fibrosis parameters from a single unstained slide, and that's of course a lot more than a pathologist could do. Potentially they're all included in our 5-tier system, but I think, not that we want to use that in clinics in the future, but it will help us to better understand progression, regression, and what fibrosis is, how it's behaving, really.
And I think that's right. One of the things that's missing in the sort of digital path AI fibrosis assessment, at least, is an understanding of what changes in these various parameters that are being described mean, and we have a sort of reasonable understanding of what a change in fibrosis stage means or might mean to a patient, but we I think seeing cross-sectional outcome data, at least for some of these parameters, will help us begin to understand what a change, and we definitely need that if we're going to move towards digital path or AI type guided or made endpoints in the trials.
I've got two other things I want to make sure we cover, one of which I'm going to put Jörn on the spot a little bit, the other of which I'm just going to cover. So Jörn, you're chairing a session Friday afternoon, right? I was hoping you could talk a little bit about it.
They were more generous with me. I can have my glass of wine after my session, and Ian has to behave on Friday evening and get up early on Saturday.
By giving Ian a 6 o'clock session, we're allowing him to control his wine and blame a third party. It's a wonderful thing.
So this is not abstract-based. This is an interactive session. I guess they were called earlier Meet the Experts. Now it's more of an interactive discussion session. I'm running this with Elisabetta Buccianesi from Turin. They've done some great studies together with the Newcastle group and other colleagues on lean NAFLD, and we'll be joined by, among others, Shira Salvasaggi as a discussant to, revisit the concept of lean NAFLD. To me, it's always a very broad bucket, and we are combining a lot of patients there. The lean NAFLD, I think, is more diverse than the other typically metabolically burdened patients we're seeing, and we'll be discussing some of those pathophysiological aspects, the role of genetics, and then we have Shira there, and she'll be, of course, detailing management of lean NAFLD, because that's not easy. I mean, the drugs we've been discussing here, the weight loss and insulin sensitizers, they could help a little bit, but of course, that's not the main driver of their disease there, necessarily, overweight and obesity. So the German guidelines, we actually just speak about physical exercise for these patients, and I think we can do a lot more. And if you're interested, come join us. We're open for the discussion, and we have great faculty to lead us through the session.
That sounds fantastic. There's also a session Friday at 3 that I don't think I'm educated enough to handle, but I'm kind of hoping that someone will handle and then come on this podcast and talk about, which is the role of miRNA and LNC RNA in liver disease, where they actually have 3 papers with Q&A, one talking about small and long non-coding RNAs in liver cancer, one talking about long non-coding RNAs and RNA-binding protein complexes in HCC, and one talking about non-coding RNAs in non-malignant liver diseases. If some of the future is going to be in that stuff, this should be fascinating, even if we're early on. It's being co-chaired by Sven Diedrichs from Freiburg, Tushar Patel, and I'm not sure exactly what will come out of it, but I'm pretty fascinated. And then with that, let me ask you guys, before we go to final, anything else you want to comment on? Ian, other papers, other things you're hoping to get out of the meeting, besides a good, decent wine on Friday night and a hellacious Saturday morning? What is the session? So tell us, what is the session you're chairing at 8 o'clock on Saturday morning?
Oh, so on Saturday morning, I'm chairing a Meet the Expert session. Not chairing I'm running a Meet the Expert session with Peter Jepsen from Aarhus in Denmark, and we're talking about early diagnosis of liver disease, and it promises, at least according to the questions that we've written, to be a really interesting discussion about, target population for early diagnosis testing or screening, what tests you would use, what interventions would follow those tests, and then there's a really provocative final question that people can think about before they come to the session, and that is, what happens if you set up this testing or screening as you think it should be, you implement it, and then it doesn't work? Why would that be? The pre-mortem of the project. And it'll be a good session. There's a lot to talk about for an hour, and we are sure to have a wide-ranging discussion about the value of screening for liver disease in the general population or in selected populations, depending on what people say.
Fantastic. And then, Jörn, is there anything else you're chairing or sharing at the meeting that you'd like to go over with us before we go to final question?
No, again, there's a number of presentations I'm co-authoring. I'm very excited about the big diagnostic NAIL-NIT data, and I think they have 5 or 6 presentations. One is going to be given by me as a poster. Also some novel stuff derived from actually the SEMA weight loss step 1, step 2 studies, looking at some novel biomarkers, somologic proteomics there. So I think a lot of things to look at and do, and really the start of a big step in improving our understanding of the disease, pathophysiology, treatment, diagnostics. Very exciting, EASL.
I agree, and I share a thought that Ian mentioned possibly before we went on air, possibly after we started recording, about packing all this into fewer days than before and having so much more to do. This meeting could take 4 days and give you time to think about everything between events, but I understand Alexander Krag came on and explained why they went to 3 days. It makes perfect sense. It's just going to give us a higher level of brain exhaustion by the time we're done, I think. With that, any closing comments about the meeting?
One abstract I stumbled across, again, because the general sessions are the ones where you have the highest ratings. In the general session 2, there's actually an abstract on bariatric endoscopy, weight loss, and the effect on steatohepatitis, endoscopic sleeve gastroplasty. It's general session 009, an effective treatment in steatohepatitis, prospectively multi-center randomized trial. The abstract is under embargo, so not much to be discussing, but the urgency to tackle this disease, and I think we're hopefully going to move away from surgical or let's say suturing techniques, might still be of need for a subset of patients, but it shows how big the need is to develop effective drugs. And the drugs hopefully will come into the arena of weight loss that these procedures can achieve in patients.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingnash.com. We hope to be back early or middle next week with a preview of the ADA convention in San Diego. We will clearly be back next weekend with a bunch of coverage at the EASL event itself. So until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.